So let's see the problem. Whoa, hello.
This has been an ongoing thing, and I kept thinking maybe he'll stop this, he'll outgrow this, but he's not.
All the laughter aside, that can actually be dangerous because it can block off the blood supply. It can damage the urethra, which is the tube from the bladder to the outside.
Toby, go get it. Go get it.
In Cambridgeshire, sprightly 3-year-old Toby doesn't look like he needs a visit to the vet, but Toby's developed a disturbing habit.
Toby. Well, Toby is our little puppy. He's not a puppy. He'll be 3 in July, and he does have his problems.
Yay, good man.
He'll come outside, he'll have a wee, and then he'll go inside and then he'll start licking. And then he'll lick and lick and lick his private bits. I would have thought that once he was neutered,
that would taken care
that
of.
would taken care of the problem, but this has been an ongoing thing. And I kept thinking maybe he'll stop this, he'll outgrow this, but he's not. Oh, it's terrible, isn't it? We've tried the collar. It's very restrictive for him.
Yeah.
I've got the little onesie type thing, and that stops him. But as soon as you take that off, he's right back at it.
Somebody's gonna have to sort you out.
While putting on a brave face, expat American Pamela and her husband Kevin are worried about why Toby is excessively licking his penis.
Once it comes out and it gets stuck, then there is signs of discomfort that he's getting because it is stuck. So from that side of things, the problem needs sorting.
Are you ready to go? It's gonna be a long trip.
Pamela and Kevin have contacted Scott, hoping he can help.
I emailed Scott. It was quite an explicit description because I thought he would need more details.
Hopefully Scott
Can sort him out.
Hello.
Hello.
You must be Pamela and Kevin. How are you? Good to see you.
Good to see you too,
Thanks for coming down and seeing us. Now let's see the man of the hour.
The man of the hour is Toby.
Toby.
Hello, handsome boy. How are you? All right then, come on, Toby. Let's get you in that consult room. Hey, stop making Kirsty blush. Come on. Pamela and Kevin have written me possibly one of the funniest emails I think I've ever read, and I needed to meet them off the back of that, and I need to meet this dog, Toby. He's been a very naughty boy. So let's see the problem. Whoa, hello. Yeah. Does it stay out that far a lot?
Yes, most of the time.
Really? Most of the time it looks like that. How does it come to be out?
He will go outside sometimes, have a wee, come in. Dogs normally lick themselves after they've had a wee.
Yeah.
He just continues.
Right.
And then he'll lick and lick. And if I call him, he'll look up at me like, yeah.
The problem is something called paraphimosis, or in layman's terms, having your lipstick out, is something that we do see in the vet practice quite regularly. But generally, with castration, the testosterone level wanes and these animals are absolutely fine. But in Toby's case, not only has castration not worked, but it's actually got worse. So I wonder if it's that he is a little bit sensitive in that area, and then by licking the area to appease whatever it is that's irritating him, he's stumbled across the fact that's a pretty enjoyable pastime, and then he's just taken it to a whole other level.
Yes.
Yeah.
I think we need to look at this as a two-pronged treatment.
Right.
The penis is almost a little bit too big for the prepuce, the skin.
Yeah.
So it's almost like the banana's too big for the banana skin.
Right.
And when it pops out, it actually almost tourniquets around the end of his willy.
Yep.
And all the laughter aside, that can actually be dangerous because
Yeah.
it can block off the blood supply. It can damage the urethra, which is the tube from the bladder to the outside. So then it can have urinary issues. It can have blocked bladder as a result. So there's a lot of potentially very concerning symptoms. So I need to try and improve its size and shape. And the way that I'll be increasing the aperture where his penis comes out is by just stretching it and opening it up a little bit. Right. I'll also be placing a tack, I think, further up to try and hold, almost if you think of, a sausage in a bun, if you held the bun up, then the sausage will stay in it. And that's what I'm hoping will happen here with Toby.
As far as I'm concerned, Toby's in the perfect hands.
I'm confident Scott's got a grip of the situation.
Yeah, that's it. That's a good one. He's got a grip of it. Yeah, Toby will enjoy that.
I'm going to sort you out first. No. I don't normally mind a puppy kiss, but for him, a handshake is better.
There you go.
Yeah. Hi, guys.
Hello. Oh, hello.
This is Toby.
Hi, Toby.
In the Richmond clinic, 3-year-old Toby is about to undergo some unusual surgery.
He's got a little bit of an embarrassing problem, haven't you, mate?
Oh, no.
Shall we share with the girls? They're nurses, so they'll understand. That's the problem.
Oh, dear. That's a bit unfortunate. So during the surgery, I'll be doing the anaesthetic and just making sure that everything's okay. Mainly the top end, whilst he deals with the bottom end.
Okay, sleepy time, sweetheart. Once Toby's under anaesthetic, I can really understand what's going on with his male parts. It looks even more prominent on his side there, doesn't it? One really painful finding is the hairs growing on the end of the prepuce are actually folded inward, and that's one of the major reasons why he can't retract his penis, because it just grinds to a halt. As it sticks to the hairs, the penis dries out and it stays out. We'll do a bit of clipping, okay, or in his case, he needs a bit of a good old manscape. So we're gonna clip all this hair away as much as we can. And one thing you can really see there is just how dry it is at the end.
It looks sore, doesn't it?
It does look sore.
Well, hopefully this will make him more comfortable.
Yeah. Come on, big boy. Let's get you sorted. Moving Toby into the surgery room and then getting all prepped and ready to go. The first thing I'm going to do is enlarge the opening that the prepuce has to allow for the penis, when it does come out, that the penis can go back into that bag and be nice and comfortable. So that's part one done. You can see now has a much bigger aperture, much bigger opening, which will just allow his willy to come out when it's going to. Now what I want to do is just place the stay suture up higher. And what I'm hoping that's going to do is stop when it retracts, it can flick back in where it should in its little sleeping bag. So you can see that, Gina? So it's now sitting up much higher. All right, there you go, there's his new designer penis.
Well done, Scott.
All right, so you can wake up. I feel that I have made sure that in future, even if Toby keeps up with this, well, a little bit of a naughty, mischievous habit, that at least his penis can return to where it should go, which is back in the comfort of the prepuce, and it looks so much nicer as well.
I'll be glad when Toby gets out of here.
Yeah.
Toby's
I heard
owners
him crying
Pamela and
downstairs.
Kevin will be relieved when they hear the surgery is over.
Hey. So here's your little champ. There he
Little man,
is.
how are you?
So he has done very well. He has a new little designer prepuce down there. So what I'm hoping is that if it does come out, it can go back pretty quickly and pretty easy. Yeah.
Scott also has a solution that should stop Toby from licking himself.
We could also use a little bit of apple spray in the area, and it might just be that he licks it. Generally, they hate the flavour, and hopefully he'll leave it alone.
Yeah.
Yes.
Very pleased. Very pleased. This is my baby, my fur baby. So looking forward to getting him home.
Well, I'm sure he wants to be quite a long distance away from me, so
Yes.
yeah. So hopefully I get to come up and see you guys in Cambridge here soon, and just see how he's getting on.
Okay.
Yeah.
That'd be brilliant.
Bye, champ. See you later.
See you later. Say bye-bye.
Okay, bye. He's like, yeah.
Yeah,
See
right.
ya.
Bye.
Bye, guys.
Bye. See you, Christy.
Go on.
Bye.
And as for Toby, Scott is keen to see for himself if the little dog's rather embarrassing problem has been sorted.
Hello, Toby. Hello, Pam.
Hello, Scott. How are you?
I'm really well.
Good.
Have you been behaving yourself?
Yeah, he's been a good boy.
Great, let's have a chat. Well, the first thing I can see is that the hole that his penis could come out of, the prepuce, is a lot bigger, so it's maintained the size. So it should mean that at least it slips back into that covering rather than get stuck out, which was the problem. The second thing was, of course, his behavioural problem, his habit of
licking
the area.
I use the apple bitter spray.
Oh, yeah, I see that here. Yeah. Oh, look, he doesn't even like the look of it now.
No, he doesn't.
It's almost like just getting out the bottles enough to put him off.
It does put him off. Scott was thrilled with Toby's progression here.
A team effort.
It was, definitely. And Toby's now a different dog.
It's very good to see now, though, that he isn't focusing so much on himself, and all that me time is now translated into family time, which is just far healthier, really, isn't it?
Yeah.
Eh? Far nicer for everyone. Hey, yes, share the love, my friend.
Hi, I'm Dr. Danny. If you enjoyed this video, then please remember to subscribe to the Bondi Vet YouTube channel. Click on the screen now to continue watching more great content.